An infant had to be flown to Temple from the Texas Medical Center. We have the latest on the COVID situation in Texas. Plus, the Texas Education Agency making changes to its COVID policy. Tonight, we see what those changes are. And they say better late than never. We hear from a Bryan man who finished his dream 70 years later. Your KRHD News starts right now.
Connecting the Brazos Valley. This is KRHD News.
Thanks for joining us at 10. I'm Naya Gonzalez. One family is caught in the middle of the increase after an 11-month-old baby became infected with COVID. LGBJ Hospital didn't have room to treat them. Tonight, doctors and healthcare workers over 150 miles away are now treating her.
When she heard 11-month-old baby girl had to be airlifted to a hospital in Temple for COVID treatment, Dr. Krhd Probst was disheartened but not surprised.
The emergency rooms at our major children's hospitals here in Houston, the home of the largest medical center in the world, are extremely crowded. They are filling, if not full, as are the hospitals and as are the intensive care units.
The veteran pediatrician says every hospital system is seeing increases in pediatric patients. In this particular case, the parents brought the infant to LBJ Hospital, where doctors quickly determined she needed pediatric ICU care and tried to find her a local hospital bed.
We actually initiated a transfer request to a facility with a higher level of care for pediatric patients, and we were unable to identify a facility in Houston.
So what's causing the pediatric bed crunch? A number of reasons. The COVID-19 Delta variant, an increase in respiratory illness, RSV, typical summer childhood injuries like falling off a bike and breaking an arm, and also back-to-school health checks.
The level of sick visits that we've seen this summer, June, July, and now August, I've never seen in 20 years of practice here in Houston.
Dr. Probst is worried with the state not allowing public schools to mandate masks, the situation will get worse.
It is typical that 2 weeks after the start of school, we see a great surge of strep, of other sources of infection. We are bracing ourselves because this year it will. It's not a question of whether it will. It will be bad.
She's urging everyone to get vaccinated and mask up.
Well, if there aren't any beds for one person, then how many ICU beds are there in the state? The Department of Health says there are 450 ICU beds available in Texas and almost 8,000 hospital beds. In Service Area N, which covers the Brazos Valley, there are only 3 ICU beds and 55 hospital beds available for about 360,000 people. COVID patients are currently making up about 15% of all hospital patients in the region. COVID-19 hospitalizations are the highest since February, the Texas Department of Health saying earlier this week. Texas is facing a new wave. Delta has erased much progress to end the pandemic. Full vaccination protects nearly all from hospitalization and death. And the Delta wave is increasing hospitalizations at similar or faster rates as the previous Texas waves. There's a huge difference this wave. We have a safe and powerful vaccine that saves lives. According to the latest data, Texas is seeing 5,000 more cases per day than this time last week. The state reporting 11,000 new confirmed cases yesterday. The average number of deaths is also up 11 per day compared to a week ago. Yesterday, 76 new deaths were reported from COVID-19. Temporary virtual learning is now back on the table for public schools across Texas thanks to new guidances released by the TEA. KRHD News reporter Rachel Espaillat explains.
TEA announced it will provide funding for schools, allowing students up to 20 days of virtual learning if they have COVID or are exposed to the virus.
This is one of those actions that's coming from the state where we're just going to continue to evolve and adapt.
Students will have to meet specific qualifications to learn virtually. Once they are placed, these students will not work concurrently while the school day is going on.
We've been adjusting for a year and a half now, and when you get to the essence of serving the child, the adults just have to make the concessions necessary to meet the needs.
While the principal wishes it was more than 20 days, he appreciates TEA allowing school districts to apply for a waiver if more time is needed. Rachel Espaillat, KRHD News.
Bryan ISD holding a groundbreaking ceremony today to mark the beginning of the first new school to be built for the district since 2008. The groundbreaking for immediate school number 3 took place this morning at the corner of Bonham Drive in Wilkes Road, neighboring Bonham Elementary School. The construction of the new intermediate school will allow Bryan ISD to reduce the class size number of the existing 2 intermediate schools while simultaneously accommodating growth.
Well, we are excited. This is a culmination of a lot of work in our community saying to us we would prefer smaller intermediate schools, and we listen to them. So today is an opportunity for us to really celebrate that it's coming to fruition.
In the coming months, school district leaders will meet with the community to discuss possible names for the intermediate school, and the building is expected to be ready for the start of the school year in 2023-2024. We know the saying, it's better late than never, but for this Bryan native, the meaning holds the weight of Aggie gold. For Dr. Joe Knowles, the journey into obtaining a biology degree from Texas A&M began in the spring of 1947. A lifelong dream will come true Friday, August 13th at Reed Arena as the Bryan native walks across the stage with the Aggie class of 2021. 70 years later, with the help of a neighbor and the experience from using this medical bag, Dr. Knowles is getting his undergraduate degree. Dr. Knowles was a young boy in Bryan in the 40s during World War II and worked as a local paperboy. He saw something on his routes, often something that meant sacrifice and honor.
13-mile paper route every afternoon. I passed lots of windows that had stars in them. There, people in that house were in the Army. A lot of those stars were gold, and you know what that meant.
And an Aggie degree would certainly be a star in his window. Originally, he was meant to be a member of Texas A&M class of 1950. He says he's always been an Aggie, enrolled or not.
This week, we learned that 2 more officers who responded to the January 6th attack at the U.S. Capitol have died by suicide. At least 4 officers who defended the Capitol have now died this way. A recently started program aims to help Capitol Police work through their trauma and hopefully prevent more tragedies.
Giving people the tools they need to understand and take care of themselves and become aware of their stress before it gets to that point, and creating an atmosphere where you can talk about what you're experiencing and not feel so much shame or move through the shame.
Psychiatrist James Gordon is leading the program with Capitol Police. He says this as something that can be replicated in police departments across the country. The program through the Center for Mind-Body Medicine is working to help create a culture of self-care and vulnerability in police departments.
This is not, bringing a whole bunch of therapists somewhere. It's not just teaching a yoga class or teaching a meditation class. We bring all of those aspects into our work. It's creating a whole program that creates change in the culture for everyone and that doesn't stigmatize or isolate.
He says officers learn coping mechanisms and techniques related to breathing and diet, but he says ultimately it is important for officers to share their experiences with each other. Capitol Police need Congress to pass additional funding to expand the mental health program. Dr. Gordon is hopeful that Congress and state and local governments will see this type of funding isn't just in the interest of the officers' well-being, but it also helps retain officers and helps with community relations.
I'm hopeful that the work that we do with police and also the focus on the mental health of police will help everyone in this country begin to come to terms with all the stress that all of us have been under.
The Center for Mind-Body Medicine has online groups available to anyone. You can find information about them at cmbm.org. All right, next on our lineup, researchers are getting closer to figuring out what may cause a deadly form of heart disease in dogs. The new findings pointing towards certain ingredients in dog food.
A brand new special session starts tomorrow, but will House Democrats return to Austin? When we return, we look at what lawmakers are now planning. With the special session now over, will Texas House Democrats return to the state in time for the start of tomorrow's new session? While holding a press conference today, the group did not offer details on their plans, but indicated a, quote, significant number of members could remain in D.C. A San Antonio rep said Democrats would not telegraph their message. but added their focus was in Washington so long as Congress was in town. Governor Greg Abbott announcing an additional month of funding for the state legislature. The current legislative budget is set to end the 31st. Governor Abbott vetoed the funding after the regular session after Democrats left the Capitol right before the end of the session. If funding ended, about 2,100 staffers would lose their jobs. Governor Greg Abbott is asking the Department of Family Protective Services to determine if gender-confirming surgeries for transgender children is child abuse under state law. Medical experts say surgery is rarely used for affirming a child's gender. A DFPS spokesperson saying it will begin the work immediately. Transgender advocates say the move is more of a political move and won't have much of an impact on gender-affirming care. And now let's get a first check on our weather.
Well, conditions across the Brazos Valley this evening, well, they're drying out. We've had some showers in the area, even some thunderstorms, but over the past few hours, you'll notice how that has pretty much faded away, and any of the green that you're seeing right now, those are false returns from the radar beam. So that one's pretty much all wrapped up, and we're done with the shower activity for tonight. And by the way, that's the last rain that we're going to see for a while, because now we're going to enter a stretch of 5 to 7 days of some dry weather, and that does mean it's going to be getting hotter. Tonight, temperatures right around 74 to 75. Looks like 75 at Bryan College Station, Madisonville at 71, 73 in Caldwell, as well as Rockdale. And tomorrow's high temperatures add about 20 degrees to that, and you'll find 93 degrees for many locations, including Navasota, Anderson, and Somerville. Franklin at 92 and Madisonville should be at 92 degrees for tomorrow. Now, again, this warm up, we will soon find ourselves talking about 94, 95, and even 96 down the road. So going into tomorrow, it should be a rain-free day. FutureTrack has been over the past few runs trying to spit out some showers here and there, which I'm not buying that one. I think that's going to be a dry day for your Saturday. Sunday, though, we're all in agreement here. It's going to be a very sunny day. No rain in the area, and those temperatures will continue to climb. So what does that mean for tomorrow? Well, 75 degrees at 8 a.m. Partly cloudy throughout the day, mostly sunny by 4 o'clock, and we'll be up to 92 degrees by that time. Your high temperature for Bryan College Station, again, should be about 93 degrees. 83 degrees at 10 o'clock. With definitely the clouds kind of winding down, and your winds should be out of the south at about 10 miles per hour. So we will also be 95 degrees on Monday, and as I mentioned, there is no rain to go around until you get to Friday, and even then it's just a 20% chance. We're going to get up to 96 degrees for Tuesday and Wednesday. That might be the warmest we get for a little while, but then we bounce around 95 to 96, and then yes, there are some 97s way out there for next weekend and into next week, with morning lows in the mid to upper 70s.
The mystery behind the diets that may cause dogs to develop a deadly form of heart disease is slowly unraveling.
So we looked at foods that have been associated with DCM and more typical foods. And I think the key results were interesting because we were able to identify quite a few specific compounds.
Vet nutritionist Dr. Lisa Freeman is part of a team at Cummings School of Veterinary Medicine at Tufts University. They looked at dog foods associated with dilated cardiomyopathy, and they were able to identify biochemical compounds that were higher and lower in diets associated with DCM. 4 ingredients distinguish the 2 diet groups: peas, lentils, chicken or turkey, and rice. Now, of these, peas showed the greatest association with higher concentrations of compounds in DCM-associated diets.
And again, those could be things that could be too low in the diet or could actually be too high in the diet. So that's one of the next steps that we'll be looking at, both in the diets as well as in the dogs themselves.
Now, Dr. Freeman says this is no smoking gun. Instead, it just gives them the compounds to target in their next research in dogs. Meantime, she recommends talking to your vet about a diet that is best for your dog based on size and breed. Also, buying from well-established dog food manufacturers, and buy food with common, well-researched ingredients, including grains.
This is a problem that really has been literally keeping me up at night, so I wish we had the answer. But I think it does get us a step closer to solving the problem and gives us a lot of targets to look at in greater detail.
The FDA has reports of dogs and cats dying from this particular heart disease that were on all sorts of diets. It could be about the amount of ingredients or a combination of ingredients or genetics, and that's why vets nor the FDA are steering dog owners away from any ingredient in particular. But the FDA has identified food brands associated with the investigation. All right, next in our lineup, e-bikes are booming in popularity as the pandemic continues on. The new surge that businesses are dealing with. First, we told you about the bike shortage that has left some store aisles bare. Now demand for electric bikes is making them harder to come by. During the pandemic, e-bikes have become a hot commodity, but the eco-friendly rides can be pricey. Usher Krhd takes a look at the e-bike trend that you might want to wait to buy in for in order to save some big bucks.
Pandemic boredom.
I started working from home. I was like, I need to get out of the house.
A lack of parking.
I actually sold my car because this was just so much more convenient. You could park on the sidewalk.
Drove Eve Santiago to pony up a few $1,000s for her electric bike.
They're big investments.
But after a few modifications like a new headlight, seat, and upgraded battery, she was off.
If I need to get around traffic, I can easily go into the bike lane because it's an electric bike. It's way more convenient.
It's that convenience that has sparked a boom in the e-bike industry as Americans seek ways to get outside while avoiding commuter crowds.
The catalyst was clearly COVID, and people became more aware of alternative transportation.
During the pandemic, California-based Pedigo Electric Bikes, which has about 200 retail stores around the country, reported sales of $121 million.
Our stores are doing 2 and 3 times the volume they did. Used to take a year before they break even. Now they break even in month 1, and they start making money in month 2. It's just, I've never seen anything like it.
Advocates say e-bikes are great for users with limited ability and mobility, and can even lead to a car-free household.
Electric bicycles are truly unique in that electric boost just expands the physical activity of bicycling as an option to so many more Americans.
It's also eco-friendly. A 2019 study from the Transportation Research and Education Center found that a 15% increase in e-bike use across the U.S. could reduce 11% of transportation-related CO2 emissions and would replace 72% of car miles that would have been traveled for strictly practical purposes. Electric bikes can range in price from the very low end at around $600 to $8,000 for high-end e-bikes, not including customization. If you're in the market for an e-bike, it's important to note there's an effort to try and make this kind of transportation more economical for the average consumer. The E-Bike Act, introduced in the Senate with a companion bill in the House, would prioritize electric bicycles as a zero-emission mode of transportation. If passed, it would give consumers a refundable 30% tax credit on the purchase of a new electric bicycle, up to $1,500.
So we're thinking lower income Americans, you are still fully eligible to receive this credit.
Advocates say the goal is to replace short car trips with CO2 eliminating electric bike trips.
You can do it with cargo in the back. You can do it with your groceries for the week. You could do it for deliveries, things like that. It makes hills that much easier, longer distances a bit shorter.
For enthusiasts like Eve Santiago, it's just charge and go.
It's so much more convenient to say, hey, I've got to go run an errand, I'm going to hop on the bike. You don't have to worry about street parking. That is a huge, huge thing.
Reporting from Chicago, I'm Usher Krhd.
From Olympic hopeful to battling the healthcare system, a retired athlete is among millions whose livelihoods have been threatened by medical debt. Now, while Congress passed a new law banning surprise bills, it doesn't go into effect for months, and some are telling Amanda Brandeis that it's important that we all learn our rights now so we're prepared.
As the saying goes, everything happens for a reason.
Yeah, exactly. If I was more punctual, if my alarm went off, I wouldn't be here.
Phil Guyman was a junior in high school when he missed the bus that day.
Rode my bike to the shuttle where they switch buses, and I got there faster.
His new solution to sleep in longer.
And then I kind of enjoyed it and accidentally lost like 40 pounds.
And eventually turned it into a career.
It was the first thing I was ever good at.
But after 8 years, his pro cycling career came to an end.
It wasn't a tough decision because there's just not that many spots.
But retirement would prove to be another happy accident.
Real pleasant day to be out here killing myself.
Or as he calls it,
I'm on year 5 of worst retirement ever, which is almost as long as I raced, and my life's a lot better.
So I'm at 13,000 feet now.
He was still training and posting content online, gaining followers and sponsors.
I was far more valuable having adventures on YouTube and getting hill climb records than I was finishing 18th at, some weird race in Belgium no one's heard of.
3 years into retirement, he got a call from USA Cycling.
I just thought, like, cool, I'll go there, I'll make one video for my YouTube channel, Phil tries out for the Olympics, and that'll be the end of it. But I went, and my time was really fast.
3, 2.
Then it was basically throwing all my plans and the rest of the year in the trash, because if the Olympics is possible, then nothing else really matters.
But just as quickly as it came, the dream was taken away. A life-threatening crash in the qualifying race sent him into retirement for the second and final time.
The next 2 months were just like a blur of hospitals where you can't even tell day from night.
He received care at 2 East Coast hospitals.
I do have health insurance, and I'm fundamentally okay. It's going to be a little bit, but I'm okay. And I would like that you take that money and give it to No Kid Hungry, who needs it more than I do. And ironically, I was not covered.
While he had 2 insurance plans, the care was out of network. Most of his claims were denied, leaving him with $150,000 in medical bills.
And for months, I thought it was a mistake.
He says some of the charges weren't adding up. Fighting them became his full-time job.
I was freaked out when it was $90,000 and the second bill came, and that might have been like the first time I cried in the entire accident.
A new law in effect next year bans providers from charging out-of-network prices for emergency care. For scheduled procedures, out-of-network providers must give patients an estimated bill ahead of time. Ambulances, however, will still be exempt from the law.
A lot of people are scared into paying for these bills and bullied into it or tricked into it. In a lot of ways, they try to do all that to me.
The law will create one system for filing complaints, which can be made verbally or in writing. The government must respond to claims within 60 days. Providers could face up to $10,000 for each violation.
I picked a cause, and I believe in No Kid Hungry, and the cause of medical BS found me. I don't want to spend the rest of my life being a politician or spouting about that, but it is something everyone needs to know about.
I'm Amanda Brandeis reporting.
All right, Amanda, thank you. 33 states have laws on the books protecting patients from surprise medical billing, but in states that don't, patients must often advocate for themselves. When possible, only go to a hospital in your network. Check to make sure the care you receive from imaging services to surgeons are covered by your insurance plan. And if you don't think you need an ambulance, it is within your rights to refuse a ride. Also, always ask about assistance programs to help offset the costs. Now, finally in the lineup, a security risk discovered on e-readers. We have what to look for on other devices in your home that are connected to the internet.
Jimmy Kimmel's up next. Garrett Hoddle is back for 6 a.m. at Good Morning Texas. Plus, we're always on our 25 News mobile app. Thanks for